Traumatic brain injury and intimate partner violence. The Brain Injury Association of America defines a traumatic brain injury as an alteration in the brain function or other evidence of brain pathology caused by an external force. In 2013, roughly 2.8 million traumatic brain injury related emergency department visits, hospitalizations, and deaths occurred in the United States. There are two stages of events with traumatic brain injury, primary and secondary. Stages of events with traumatic brain injury. The primary event is the initial trauma and the results that immediately follow, such as becoming unconscious after being hit in the head with blunt force. The secondary event are the changes that take place gradually after the initial trauma happens, such as memory loss. It can happen in a time span of minutes to weeks. Secondary events may result in structural changes to the neurons, metabolic dysfunction, or even cell death. Secondary events have been more significant and more disruptive to the brain than the primary event. In categorizing TBIs, professionals use the Glasgow Coma Scale. The Glasgow Coma Scale was created in 1974 by Graham Teasdale and Brian Jeanette to measure the estimated level of consciousness in a patient immediately after a traumatic injury. The 15-point scale is based off the patient's behavioral and observation of the patient. It is divided into three categories: verbal response, motor response, and eye-opening. Traumatic brain injury is broken up into three severity levels based off of Glasgow Coma Scale scores. A GCS score of 8 or less suggests a severe traumatic brain injury. A GCS score between 9 to 12 suggests moderate severity traumatic brain injury. And GCS scores of 13 to 15 suggest mild traumatic brain injury, also called mTBI. Severe traumatic brain injuries are life-threatening, can be an open or closed head or neck injury. If the person survives, they will need prolonged hospital stay along with extensive rehabilitation services while they're in the hospital and once they're discharged. In most cases, the person does not return to their pre-injury status. With moderate traumatic brain injuries, the person has a loss of consciousness lasting more than 30 minutes, ranging to a few hours, can have confusion that lasts from a few days to weeks, and their cognitive, behavioral, or physical losses that last for a time span of months or become permanent. Mild traumatic brain injuries are a little bit different. They are harder to diagnose in patients compared to severe and moderate traumatic brain injuries. Cases of mild traumatic brain injuries do not show up on a standard radiological scans that are used to diagnose more severe cases of traumatic brain injuries. Oftentimes, a person is discharged with a mild traumatic brain injury without them knowing. The Mild Traumatic Brain Injury Committee defines mTBI as any period of loss of consciousness, any loss of memory for events immediately before or after the accident, any alteration in mental state at the time of the accident, examples of feeling dazed, disoriented, or confused, and focal neurological deficits that may or may not exceed the following: post-traumatic amnesia not greater than 24 hours, after 30 minutes an initial Glasgow Coma Scale of 13 to 15, and loss of consciousness approximately 30 minutes or less. Mild traumatic brain injuries are diagnosed with extensive screenings and history taking from the patient, such as asking where on their body they got hit, how frequently, and how many times. Intimate partner violence is defined as behaviors that are intended to exert power and control over individuals and includes physical, sexual, verbal, emotional, and financial abuse and/or stalking. The National Center for Injury Prevention and Control estimates that more than 1 in 3 women will experience intimate partner violence in their lifetime. Intimate partner violence can happen where the victim is a man, but majority of cases the victim is a woman. Risk factors for experiencing intimate partner violence. Risk factors for a person to experience intimate partner violence include, but are not limited to, previous traumatic brain injuries, history of mental health issues such as anxiety or depression, childhood experiences, substance abuse, perceived stress, or medical conditions. In some cases, socioeconomic status and one's culture also can be a risk factor for experiencing intimate partner violence. Intimate partner violence related traumatic brain injury. In acts of physical abuse, it is most common for the victim or survivor of intimate partner violence to experience hits to the head and neck area along with strangulation. Repeated or powerful hits to the head can result in brain damage. Loss of oxygen from strangulation can shut down bodily organs. Events of intimate partner violence often go unreported, resulting in many victims or survivors not knowing that they have a mild traumatic brain injury. Some survivors of mild traumatic brain injury go undiagnosed or misdiagnosed with something such as post-traumatic stress disorder from their intimate partner violence. Because these symptoms are so similar, it is very difficult if a provider is not fully trained and extensively knowledgeable on intimate partner violence to discern the two. Traumatic brain injuries in victims of intimate partner violence occur on multiple occasions over a period of time versus one traumatic incident. Complications of traumatic brain injuries from intimate partner violence include decreased cognitive functions, resulting in many things, behavioral changes such as anxiety, depression, increased anger and aggression, and medical complications such as recurring headaches, nausea, increased morbidity and mortality, overall poor health, disruptions in the immune function, and trouble sleeping. Effects on communication from traumatic brain injuries from intimate partner violence include memory loss, trouble focusing, trouble with problem solving, and self-awareness of the deficits. In more severe cases, where the physical violence resulted in moderate or severe traumatic brain injury, the survivor will need rehabilitation for help with any articulation problems due to facial trauma and damage, and help with cognitive and language functions if they have become impaired, and awareness. In cases of intimate partner violence that results from a mild traumatic brain injury, the most common complaints from women are memory loss, trouble focusing, and impaired problem-solving skills. A victim that is in an existing violent relationship has a higher risk for more abuse because of the lasting cognitive effects from previous incidents. If the victim does not go get help, she cannot learn the skills to further break down what somebody is telling her in order to truly solve a problem. Survivors have a hard time maintaining a job because they can't stay on task, they have auditory comprehension problems, and can become socially withdrawn because of their deficits. There are many difficulties in reporting intimate partner violence. The victim can cohabitate with their abuser. A big one is the fear of being judged by medical staff or law enforcement. In a recent study, a survivor said, "I don't trust any doctors really. I feel like I'm wasting my time. That's how they make me feel. I mean, I've been in and out of hospitals my whole life, and I've been seeing psychiatrists my whole life, and I'm still the same, living in fear." Other difficulties include fear of consequences from the abuser. There is a strong risk of death, financial stability from their abuser, fear of a confirming medical diagnosis. Another victim in that same study commented on the fear of a confirming medical diagnosis. She stated, "They told me I needed to go to the doctors right away, but I never went because I know there's something wrong with me. I know I'm not normal after that. I know there's something wrong with my head or my hearing. I don't want them to tell me I'm going deaf or anything like that." A big thing also is wanting to keep families together if the survivor or victim has children with the abusers. There's often a higher priority over protecting the children versus the mother going to get help for herself. Using isolation as a protection. And finally, the "I survived for this" mentality, where many of the survivors feel like even though they've gone through the medical process and have also gone through the legal process to do what they need to do, but still have all of these lasting deficits from their years of abuse. Areas of improvement for intimate partner violence victims with traumatic brain injuries include more research and media exposure. Recently, traumatic brain injuries have gained exposure for NFL players and military veterans, but not for intimate partner violence victims. People will not know that it's happening constantly unless they put a face and put it out there. Having professionals who will encounter victims or survivors of traumatic brain injury be more educated on the topic. When people are more educated on the topic, they can more accurately diagnose someone with a mild traumatic brain injury versus diagnosing somebody with post-traumatic stress disorder. The more people know about intimate partner violence that can result in traumatic brain injuries, the better. The more knowledgeable people can result in getting rid of the stigma that comes with being a victim and could potentially improve the trust and relationships between victims and medical staff. Also, educating the medical staff on how to interact with the victim or survivor, such as pointing out their strong areas instead of only telling them what's wrong with them. Educating the general population on the signs and symptoms of mild traumatic brain injury so they will know what they're looking for. A lot of women thought they were just having headaches or lack of sleep because of stress, but when they eventually got a screening and a detailed history report, they learned that they had indeed a mild traumatic brain injury. And finally, a huge area for improvement is making resources available for survivors and victims. Many women don't get help because they cannot go to one place and get medical attention, also legal advice, and if they have children, they would need somebody to also watch their children while they do all of that, at the same time being feared for their life from their abuser.